The patients go to the sleep center and they are monitored as they sleep. And when patients are diagnosed with sleep apnea, the number one treatment for sleep apnea is a CPAP machine. And what sleep apnea occurs when you fall asleep and your airway is obstructed. And so your body's not getting the oxygen that it needs. And the tiredness comes as your body's fighting to get you the oxygen by waking you up enough to take a breath, but then you fall back asleep. And so a CPAP machine, it pushes air down into the lungs so that people are able to get the oxygen that they're otherwise not getting. But unfortunately, not everybody can tolerate a CPAP. CPAP has constant air pressure being pushed down into the lungs, and some people can't tolerate the air escape that gets them in the eye, or the noise from the machine is disturbing their bed partner. For various reasons, they might not tolerate the CPAP. They return to the sleep center asking for alternatives, and we're the first line of defense that the sleep center sends them to. So when we see patients from the sleep center, they're coming to us with a diagnosis of either mild, moderate, or severe sleep apnea. These oral appliances that we make work very well for people with mild to moderate sleep apnea. We do have some patients who have severe sleep apnea who have had some relief, but not full relief through one of these oral appliances. The concept behind an oral appliance is that when you fall asleep, your anatomy slumps back and obstructs your airway. And so an oral appliance, the purpose is to hold that anatomy forward so that when you fall asleep and your anatomy wishes to slump back, it doesn't. It's held forward so you're able to breathe closer to how you were breathing when you were awake. And so these oral appliances, we have two different kinds that we use. One of them holds your entire jaw forward, while the other one takes your tongue and it holds your tongue forward. We've been doing these oral appliances in our clinic for well over 10 years. And so we have a lot of patients that have had this treatment done, and we see them back to see how they're doing. And people are often very, very happy with the results. It improves their quality of life as they are not falling asleep during the day. My mother, a long time ago, she was diagnosed with severe sleep apnea. And before she was treated for sleep apnea, she pretty much fell asleep every hour. If we drove anywhere, she often was pulling off to the side of the road to take a nap. But after she started on a CPAP, she was a whole new person. She lost hundreds of pounds, literally, and she wasn't falling asleep all the time. She had all sorts of new energy, and that's what people benefit from as they are treated for their sleep apnea, whether it's from a CPAP machine or one of these oral appliances. It really increases quality of life as people are able to sleep better through the night. Patients that have had the proper diagnosis of sleep apnea, and especially those who have tried a CPAP and failed it, their medical insurance often will cover the appliance. And they'll still be expected to pay whatever kind of deductibles, but medical insurance often, most of our patients are getting these appliances because their medical insurance is helping cover the costs.